There's a new app on the market. It's designed to help save lives both on Earth and beyond. Designed by a Montreal doctor, it has dramatically improved patient care, and now it has been chosen as a finalist in the Canadian Space Agency's Deep Space Healthcare Challenge, a competition that seeks to find technologies that can improve patient care in remote areas as well as during deep space missions. The app is called EZResus, like resuscitate, and helps doctors deal with the critical first hour of resuscitation. And the app provides all of the necessary tools needed to figure out appropriate emergency treatment for patients in need. Let's talk now to the doctor behind the app EZResus. It's Frédéric Lemaire, and he joins us on the line. Dr. Lemaire, welcome to the show.
Hey, thank you so much for having me.
So first off, tell me about the app, and maybe tell me about the app's implications for most people. Before we get to deep space, let's talk about your app and how it came about.
All right. So, I'm an emergency physician working at Charlemont Hospital for 10 years now, and our job is a little bit crazy. When you're working in the emergency, you never know what kind of patient you'll have to deal with, so you need to be prepared for all kinds of situations. And pretty early in my practice, it became clear that it's impossible to be knowledgeable in everything. But when you are up north, 2 a.m., and you face a pediatric resuscitation, even if you are out of your comfort zone, you need to act very quickly. So I was like, I'm not going to look this in books or just search the web. So we need to kind of create a reference tool that we can access super quickly for those quick interventions we need to do to stabilize patients.
So, when I look at other apps, I like Instagram, it's for sharing photos and videos with your friends, and I can look at every app. Oh, well, I'll use the Gmail app is so I can take care of my email. Who is your app designed for?
So the app is really designed for anyone involved during the first hour of resuscitation. So we're talking of people working as emergency physicians, nurses, pharmacists, respiratory therapists, and even those advanced paramedics that offer care outside the hospital. But anyone that needs to act on those critical first hours.
So if you need someone who has to act in those critical first hours, you mentioned people who are in remote places. Obviously, the most remote you can get is in space, right? So take me down that path. How did you end up saying, oh, this could be useful in space missions?
In fact, this was not the plan at all. We are a team, we are a nonprofit of 30 healthcare professionals that volunteers in this, and we just want to improve patient care. But 2 years ago, there's one of the pharmacists who is using the first version of the app, EZDrip, that is working at the Canadian Space Agency. And she sent us an email like, there's this Deep Space Healthcare Challenge. You should check it out. And I was like, but we're not involved in space at all. But then when I saw the video from David Saint-Jacques, I was like, let's say that, you go to Mars and midway there's an emergency. And you say, Houston, we've got a problem. And there's like a 20-minute delay. I was like, that's kind of a Friday night in the emergency room. Super chaotic. You need to act. You don't have any help. So I was like, okay, so let's just try our best to this challenge.
We are with Dr. Frédéric Lemaire, an emergency physician behind the app EZResus, like resuscitate, and the app is being looked at now by the Canadian Space Agency, perhaps for deep space healthcare issues. So, Dr. Lemaire, take me through, a deep space mission and how your app could be used to save a life.
So something that I was not expecting at first is that the challenges of taking care of a sick patient are quite the same in remote areas and in deep space exploration. So let's say that you've got a bunch of super smart people, but that they don't know everything about medical emergencies, right? Because they have all those astronaut stuff to know about. So let's say that you are going to Mars and someone starts seizing, and then you need to administer a first dose of a critical medication. If you are not used to those kind of emergencies, it's really overwhelming to look at the right dose and administer it as quickly as possible. So it would be like one of the ways where they just open the app. They don't have to enter the weight because we've got a separate app just for astronauts where they just click on the logo of the astronaut and they go to seizure, and boom, they've got all those critical steps that they need to do in order to stabilize the situation.
You've got this app. Before getting into space, on planet Earth, you have 5,000 users in 29 different countries. Do you have a story to tell about how your app has saved a life?
Oh, yes. There is so many cases, but there was one that comes to mind that we had from one of our users 1 month ago. So he had a little girl, 7 years old, who was seizing for 1 hour. And it's something that we don't see quite frequently. Usually the seizures stop, and then you've got a little bit of time to think. And then when you receive the call from the paramedics, you just entered the age of the patient and started preparing everything from the respiratory therapist equipment to the different dosage to take care of the airway and the seizure. And when the patient arrived, he told me how it was so relieving that all the logistics were figured out. So you just administer step by step. For sure, the app is not going to save a patient without an incredible team, but when the team is there, you can just alleviate all this cognitive pressure of the logistics. Our job is way easier.
Now, as your app being chosen as a finalist in the Canadian Space Agency's Deep Space Healthcare Challenge, what happens from here? What happens if you win? Do you get a free trip to space?
It would be amazing. Like the ultimate would be like a selfie from an astronaut from the International Space Station with the app. Mm-hmm. I think I could clearly retire after that. But we're going to present the prototype in November, and then we'll know in March if we make it the big winner of the whole thing. And the Canadian Space Agency then provide us funding and the potential partnership with them to just push this tool to actually use it in simulation and maybe one day in a space mission.
Knowing that the Canadian Space Agency is heavily involved in the missions to the moon that are happening now, and they are very much looking at, the Lunar Gateway and further missions to Mars, seems like a tool that would be invaluable in those situations. Dr. Lemaire, thanks so much for your time this morning.
Thank you for having me. Have a great day.
That's Dr. Frédéric Lemaire, an emergency physician who created the app EZResus.